Hi guys, I just wanted to hop on real quick and explain what orofacial myofunctional therapy is, or we call it myofunctional therapy. Um, I broke it down, so orofacial myofunctional therapy, and I'm a visual person, so I kind of wrote it out on my iPad here. So oro means the oral cavity, so it has to do with the mouth, the outside, the muscles, and the inside. Facial obviously has to do with face. You've got myo, and myo means muscle. So we've got all kinds of muscles on the outside and the inside, and the strongest muscle would be our tongue. It's the most functioning one when we're born. And then functional has to do with the function of something or how it works. And then therapy, returning to its proper function, or if you look it up online like I did, it said therapy and treatment, or treatment to heal and relieve a disorder. So I mean something is out of order, and that's why you would need therapy. So to work it back up, an orofacial myofunctional therapist or myofunctional therapist does therapy to return to order the function of the muscles of the face and the oral cavity. And you think, well, why is there disorder in the function of the face or cavity, oral cavity? And one thing to think about is we have a lot of muscles going on here, and the tongue is the number one. And there are times where it's just doesn't function properly. A huge reason why, and what I see in a huge amount of my patients that I see every day, is a tongue tie. So when the tongue is tied, it's not functioning the way it should function. And when you're born with that and it's growing, all these bones grow around how a muscle functions. That's the way we are made. However, our muscles are functioning, that's how our bones work around or grow around. And so tongue tie, another thing is sometimes when we're younger or older, we get allergies or a cold and our nose gets stopped up. And so we open our mouth to start breathing. When we open our mouth, start breathing, our tongue drops. And a lot of times it just stays that way because we get in that habit. And that has huge implication on how things grow. I was watching a video yesterday and I posted it previously. You really should watch it. It's amazing. But this kid had perfectly normal face. Everything was growing well. His parents got him a gerbil and he was allergic to the gerbil. He had it in his room and his face shape and everything just drastically changed as he aged. You should really get on, watch that video and see the picture of time as it went on. But he became a mouth breather, and because his mouth was open, his tongue was down and not up where it's supposed to be. Things started growing long and down, which then also affects the airway and all these things. So it's interesting to think about. We have, like in our arm, we have one bone right here, two bones right here. We do have a lot in our hands and our feet, but the same, there's one bone, two bones. Maybe more like our ribs and stuff like that, but they serve a purpose and the muscles work to make that do what it's supposed to do. Well, with our heads, it's not like we have a lot of moving parts here, but we have 22 bones in our head, and 8 of them is just the part that surrounds our brain and protects that. But we have 14 more just inside this area right here. It has to do with the airway and the mandible, the maxilla, around in the ear, all this part around the eyes for sure. There's several around in here and goes inside our head. Whenever the muscles with our face and our tongue aren't functioning the way they're supposed to, as we're little and as we're developing, then these bones don't grow the way they're supposed to grow. And for a lot of us, like me, I have a tongue tie, and it's affecting the muscles in my neck. There's a lot of strain going on here. I have swallow issues, all these things. I can't take pills very well. I've choked quite a bit. There's just so many things going on there that I'm learning now has to do with all this, but it's all just not functioning the way it's supposed to function and has affected the growth of me. It's affected the growth of my children. So then the impacts of that have to do with, like, for me, I have swallowing issues. I seriously thought I had a small esophagus. I thought that's what was going on with me. But now I realize I'm doing things wrong. And I'm in the process of learning, so then I'll be able to train myself. I'm very excited about that. And then help people who also have issues. But I've talked to people like coworkers who have younger children. They had no idea this is going on, but now things are clicking as we start talking. But like some are picky eaters, have a hard time with textures. That can do with a tongue tie. There's some, if you know anybody who gets food, like they pack their food in their cheeks. A lot of times it has to do with the tongue being tied. They can't sweep that food out with their tongue. If they're slow to start speaking, a lot of times it has to do with a tongue tie in a child. It's not comfortable to talk or they are not confident in it because their tongue is restricted. And as we grow, then there's issues like airway issues. That's going on with my daughter. She has a deviated septum. Her jaw is recessed too far back. Her posture is forward. She has a bump in her nose. So do I. That's from growing down, our face growing down. And so it causes tension. It can cause tension in the neck and the shoulders. That's very common with a tongue tie and with all these issues that has to do with the growth. Sleep apnea, huge. I mean, it always leads to sleep apnea. And for children, you see if they're snoring, if their mouth's open, they have issues. It can cause TMJ disorders, a lot of TMJ. I think, well, from what I learned, they call it TMD, temporomandibular joint. That's what TMJ stands for. Well, if it's temporomandibular disorder, that's a disorder in that joint. All of those, the root of that has to do with the growth and how everything's functioning with the tongue and the muscles, which is a muscle, and all the bones. So that all can be taken back to that. There's so many things. The more I learn, it's like, this is life impacting, and I'm so thankful that I've started down this journey, because I think it's going to transform my life, and just even being able to swallow right, but helping others, helping my children. And I really am excited to help other people too, even just seeing it in patients. They're like, okay, let me know when you're starting, because it literally impacts, I'd say 99% of the people I see. So you may not realize it's you or somebody you know, but when you start learning more about it, it's like, oh, that's why I do this, or that's why they do that. It's amazing how many things can go down to the function of the mouth and the face. And yeah, if we can get those corrected, we can help tremendously a lot of issues that we have. Even for some, like if they open their mouth and their teeth don't come together in the front, but it's more like this, and like cross bites, all those sorts of things, that has to do with how the tongue is working and it's not functioning properly. Narrow palates, crowded teeth, all that has to do with the tongue not being where it's supposed to be, and impacting growth of the upper palate. If the tongue's up, it stimulates the stem cells up in the upper palate to grow wider for the tongue to fit in. Well, when our tongue's down, that's not like that. So our upper palate's narrow, which makes all of our airway narrow, makes it skinny. We can't get the air we need. And then there's no room for the tongue, so then it settles back in the back of the throat and obstructs the airway. Turn sideways and look at a video. Anyway, just wanted to explain what orofacial myofunctional therapy is, shortened as myofunctional therapy. And that's why there's a new wave going across. A lot of patients have asked me, why have I never heard about this before? Because it's impacted their lives so much. And it's, from my understanding, it's kind of been known since the 1800s. There's actually a book written by a man, last name Catlin, who something about close your mouth and live. And he saw the impacts of the difference of people with their mouths open versus their mouths closed throughout the day. So it's kind of been known. It's just not maybe fully been researched until recently. And now the research is there and it's real, of how this impacts people's lives and the link to all these different things. It's just not old enough yet to be in the books, to be in the educational systems, to be taught to dentists and ENTs and all those things. So it'll get there. It's just not there yet. And that's why people like me, the more I learn about it, it's like, this is so impactful, not just for me, not just for my family, but for literally almost every patient I see. And just trying to get the word out to people, because there actually is hope for people who have said doctors just thought I was crazy, or I thought I was crazy, because nobody had answers for my issues. Anyway, just trying to get that out there. So you can send a comment, ask a question, or if there's anything else you want to know more about, feel free to message me, because I would love to address it and help you with that. Thanks.